Good afternoon, everyone, and welcome to REDI Careers Beyond the Lab. My name is Sarah, and I work with Dr. Marguerite Evans-Galia as part of the IMNIS team. It's a pleasure to welcome you all online today. As we gather for this event from different places around Australia, I'd first like to acknowledge the traditional custodians of the land on which we meet. I'm joining you today from Ngunnawal country, and I pay my respect to elders past and present, and to any Aboriginal and Torres Strait Islander people who have joined us online today. As we share and discuss our own knowledge and practices, we acknowledge the deep knowledge forever embedded in custodianship of country. So today it is my pleasure to bring you REDI Careers Beyond the Lab. This webinar series aims to share with students and teachers the breadth of STEM careers available and where a STEM qualification can ultimately take you. And many of those careers are beyond the lab. This event is an exciting collaboration between ATSI's STEM Careers Pathway initiatives, the Industry Mentoring Network in STEM, known as IMNIS, and the STELR program. IMNIS is our industry engagement initiative, which connects PhD students and early career researchers with industry leaders in a one-year mentoring program. And you'll hear more about STELR soon. Beyond the Lab is possible thanks to our major partner, MTP Connect, and is part of their REDI initiative, the Researcher Exchange and Development in Industry program, a $32 million initiative made possible by the Medical Research Future Fund. Beyond the Lab is new, and we're keen to see it grow in the coming years. So if you have any ideas or suggestions along the way, please make a note and share them with your teacher so they can let us know. We're keen to hear more. So now on to the fun part. To tell you a bit more about STELR and to lead the rest of the event, I'd like to introduce you to my colleague, Camille Thompson. Camille has over 15 years experience as a teacher and science communicator, and she's the acting director of ATSI's STELR program. Take it away, Camille.
Thank you, Sarah. So the STELR program is also part of the Academy of Technology and Engineering. It is an inquiry-based, hands-on, curriculum-linked resource for teachers and schools that expose kids to applied sciences and engineering concepts that are linked to the Australian curriculum. We've been going for 13 years and we are in over 800 schools across Australia. So I am really excited that we are now bringing our connection with students to scientists and working in all sorts of careers in industry and beyond the lab to show the skills you've learned in your classroom are actually applicable outside. So now that you know a little bit more about both of our programs, I would like to introduce our IMNIS Catalysts. All four have been through the one-year IMNIS program and are currently ambassadors for the IMNIS initiative. Joining us today is Dr. Nick Hong Sing Lee, Dr. Edith Botchway, and Thilanka Morawakage. How today will run is that our catalysts will each give us a little bit of information on their career journeys from high school to where they are now. After that, we'll have a short panel discussion between us and have a chat, and then we can move on to audience Q&A. There, you can ask any question you like of our scientists, and at any time, if it comes up either during their presentation or even during the panel discussion, you can use the Q&A function at the bottom of the screen to let us know your question, and we will get through as many as we can today and we'll have a bit of fun. So our first presentation will be Nick. Nick is a biomedical engineer working at an Australian startup commercializing needle-free vaccine delivery technology. So take it away, Nick.
Thank you, Camille. All right. Just seeing if the slides work. Awesome. Hello, everyone. Thanks for joining us. My name is Nick, and I'm a biomedical engineer. My background is in everything biomedical and everything engineering. I just love the combination. And right now, I'm a laser development engineer at Vexes, and we are working on a very exciting microneedle patch for vaccine delivery in the skin. So a bit about my own career path. I was born and raised in Malaysia, and I completed actually my year 11, year 12, my certificate back in Malaysia back in 2010. And back in high school, I just remember doing a whole bunch of different things, and there was no one particular subject that was drawn to per se, and I always loved maths and biology, even English and arts, and took up extra classes in the arts arena to just try out my creativity. But on the side, I really love volunteering as well, and I was heavily involved in the youth division of the local Red Cross, or Red Crescent, I should say, organization back in my high school years. So that was about 4 or 5 years of my time as well. And just through all that experiences and what was really taught in the classroom, that I sort of came to this realization that what really gets me going, gets me out of bed is this need to help people, or this desire make a great impact. And it sounds really cheesy, but it is something that get a lot of us, and I'm sure Edith and Thilanka would resonate with that as well, out of bed every morning. So just through that passion, that essentially guided me through my career choices, through my education choices, which is how I landed in biomedical engineering degree. And I was fortunate enough to have scored a scholarship, and I went to New Zealand for 4 years, where I did my biomedical engineering degree at the University of Auckland from 2011 to 2014. And then I carried on with a PhD in biomedical engineering in sunny Brisbane in 2015. So next slide, please. So after, just within the last few years of my undergraduates, I had the opportunity to work in the research area. So I was helping out with some research in university, a different capacity, 2 main projects as well. Of course, I was quite involved in. First was a force sensor for MRI scan, and a second was to look at the biomechanics of the knee, and investigating impacts of different flexion and different suppose angles of flexion on how that impacts the ligaments and how it helps the knee work better. And after that, with that very little research experience, I kind of jumped into a PhD program, because at the time I just wanted to learn more about biomedical engineering. I wanted to learn more about the research field and the medical research field specifically. So applied to a program at UQ, and again was fortunate enough to have been awarded the scholarship and the spot at the UQ program, where I did skin cancer research. Specifically, I was looking at different ways of making microscale devices that could interrogate the skin, and to look at how the skin changes as skin disease progresses. And through that work as well, fortunate again, was able to share my work with some of my international colleagues at conferences overseas and locally. And it was a great experience on its own. And I think I did a lot of my growing up during my PhD as well. And right after that, I became a biomedical engineer at the Australian National Fabrication Facility, where I was working with clients, both from industry and from academia, looking at medical device designs, or design of a variety of different devices, and help fabricate this. So as a consulting service, and as well as technical support. And most recently, I've moved over to Vexes, where we are now looking at commercializing a microneedle patch. So vaccine delivery into the skin using a minimally invasive method. Next slide, please, Camille. So this is just from our website. And again, feel free to have a look, and you can Google the company. And we were sort of in the commercialization phase, and I'm involved specifically in the R&D side of the business, where I'm a laser development engineer and looking at different ways to make parts of this technology, and looking at ways to help scale out the manufacturing sides of the operation. And it's incredibly exciting, and also particularly important, especially thinking about our COVID-19 situation at the moment. So, and this is one of the reasons why I picked to join the company, is the impacts that we get to make every single day, and as well as the challenges that come with it. So, yeah, I think that's me in a nutshell. Thanks, Camille.
That's brilliant. Definitely a start in one place and end up somewhere very different.
definitely.
So our next speaker is Edith. And Edith looks at how young people with traumatic injuries are treated and also examines sleep patterns and brain behaviours in children with neurological conditions. So thank you, Edith.
Thank you, Carmel. Brilliant presentation, Nick. I can very much relate to the passion to help people and to make an impact through that. So yeah, hi everyone. I'm really excited to be with you today and for the opportunity to share my career journey with you. So here we go. So this is a picture of me in high school. I come from Ghana in West Africa, and in Ghana, we have 2 stages of high school. So we have a junior high school for 3 years, and then you get senior high school for another 3 years. So this is me around age 12 in junior high school. So let me tell you some of the things. Next slide, please. So here are some of the things I loved doing in high school. I was very much a bookworm. I loved mathematics in junior high school, and in senior high school, I developed an additional interest in economics. So I was just smashing those 2 subjects. I also love study groups, so I would form study groups with some of my friends who perhaps need help with certain subjects, and we would try to help each other, encourage each other, teach each other how to solve certain problems. Especially with math, we would spend some time trying to see who will solve the problems faster, and that was really very, very fun. The other thing that I thought was interesting to mention here is that I was really involved in helping my mom with her baking business. My mom was baking and also selling ice cream to kids and also in the community. So this was very much a part of my life in high school years. And I thought it was important to mention that because I think that this experience helped me to develop a sense of independence, but also to know how to manage money and to be resilient. And I say that to encourage those of you who maybe are working in Woolies or Coles, so that just so that you know that it's a great opportunity and there's so much you can get out of it because it helps to shape your personality and who you grow to become. Next slide, please. So what am I working on now and why is it important? I am a neuropsychology researcher. Neuropsychologists are psychologists that try to understand people's behavior and experiences through activity in their brain. So how are people's brain cells reacting to different stimuli in the environment, and how can we explain their behavior based on that? I also consider myself a sleep researcher because I'm very passionate about sleep and particularly interested in how sleep can be used or can be improved to help people function better after certain neurological conditions. So in a nutshell, my research looks at understanding the impact of childhood brain injury on sleep and other functional outcomes. Next slide, please. So just a little bit about my research. So children with brain injury, whether it's from a fall or an accident, tend to have a lot of problems. They sometimes have problems with their thinking and their social skills. And sleep is also another area. So sometimes they can't sleep well or they're just sleepy in the classroom. And these problems are reported in about 40 to 70% of these children. Now, my research is trying to understand how these kids are sleeping on a day-to-day basis. Then I try to develop theories to explain why they have sleep problems. And based on those theories, hope to create interventions that would help us to improve their sleep patterns. I hope that through this research, I think you can all relate that when we are not able to sleep well on a given night, we just wake up so cranky and you just don't feel up like going to school, or even when you go to school, you're sleepy and it affects your performance in school on the day. So I hope that through this research, I'll be able to help improve academic performance in children, would help to give kids a better social life because they'll feel more energetic and excited about socializing, that they will have better behavior outcomes, and also that this research will contribute to helping these kids have a better long-term outcomes. And what I mean by that is that we hope that it would help them to grow up to be healthy and well-adjusted adults. Next slide, please. So how did I get here? I am going to tell you my journey on this slide. So I grew up in this community, small community called Afienya in the southeast part of Ghana. And that was where I did my junior high school. And for my senior high school, I went to a bit of a bigger town called Tema for my junior high school. For my senior high school. In senior high school years, I wanted to be an economist or an actuarial scientist because I love mathematics and I love economics. So I applied for these courses to 2 universities, but I didn't get into either of them for that program. Instead, I got offered psychology with sociology and other subjects at the University of Ghana. And I decided to go and do that program because I didn't want to stay home for 1 year. So I was like, okay, I'm just going to go for this. And then in the next year, I would go back to plan A. But in the first year while studying psychology, I learned about neuropsychology, which is the neuroscience aspect of psychology. And that was so intriguing. So that got my attention. I started researching into it and I realized that I actually really like it and I could pursue it as a career path. And so I did that program for 4 years. And during the course of the time, I met a neuropsychologist who was the first neuropsychologist that I know, and he became my mentor. And with his help, I was able to apply for schools outside Ghana. And so by the end, in 2013, I got on a bike and I went to Amsterdam for my master's degree at the Free University Amsterdam. I did a master's in cognitive neuropsychology. It was such a great master's. I learned so much and it really shaped my thinking and and my research career. And so after my master's, I was interested. On my master's thesis, I worked on a brain injury project that was looking at how brain injury impacts children's thinking, and we're using MRI technology for that, and it was all very exciting. And so by the time I finished the master's, I knew that I was very passionate about research and I wanted to continue in that research pathway. And the surest way to do that was to do a PhD. So I applied for PhDs in a couple of countries, and I got 2 opportunities. So one in Melbourne and one in Canada. And of course, I chose Melbourne because it has better weather, but also because the project here really resonated with what I wanted to do going forward. So I came to Australia in 2015 to start my PhD with the University of Melbourne. And I've already told you a little bit about my PhD because that was the sleep topic that I talked about. And so during the course of the PhD, while about finishing, I got to know about the Imminence program, which is the mentorship program, and I got on it. And I think that it has been a really key part of my journey because it's having a mentor through Imminence helped me to have clarity around what I wanted to do next, whether I wanted to go industry way or I wanted to do academic work. And through that clarity, I know that I want to continue doing academic work, at least for the next couple of years. And so currently I'm working with Deakin University as a postdoctoral researcher. Thank you. That's all from me.
Thank you, Edith. That's quite a trail. I like that you cycled from Ghana to Amsterdam.
Oh yeah.
So our final presenter today, our final presenter today is Thilanka. Thilanka's thesis focused on new treatments of fibrosis, and more recently, she was involved in a clinical trial investigating other vaccines that could assist with the management of COVID. So take it away.
Thanks, Camille. So hi, everyone. It's great to be here to share my STEM journey from high school to my current role as a project assistant on a COVID-19 clinical trial. So to begin with, my passion for science started at a young age when I had gone on a family holiday to Canberra to visit Questacon, the National Science and Technology Centre, and CSIRO. And this just really got me interested in learning more about the world around us and how things work. And during high school, one of my favorite subjects was also maths, partly because I was doing well in it. So when it came to year 10 to pick subjects I would complete in year 11 and 12 for VCE, I ended up choosing further maths, which I completed in year 11, maths methods, English, chemistry, biology, and physics. I actually hadn't planned to pick physics initially, but I felt given I was already doing biology and chemistry, it would be fitting. And I knew after I had graduated from high school that I wanted to do science in university, and many of these subjects were prerequisites for science university courses. Next slide, please. Thank you. So after I completed high school, I received an offer to complete a Bachelor of Science at the University of Melbourne. And I had chosen the Bachelor of Science at Melbourne Uni as my first preference because during year 10, I had been selected to participate in the University of Melbourne Kwong Lee Dow Academic Enrichment Program. And so through this program, I got a taste of what it would be like to study at Melbourne Uni. I also majored in pharmacology. And why pharmacology, you may ask? Well, during the Uni Melb Open Day, when I visited in year 12 and was looking at all the different majors that the Bachelor of Science course offered, pharmacology was just the one that stood out to me the most. And at the time, I actually did not know much about what it was all about. But during the course, I really enjoyed learning about it and how drugs work in the body. And I liked how it combined aspects of other areas of science, such as physiology, biology, and chemistry. So after I had finished my bachelor's degree, I was looking to do a postgrad degree to gain more specialised knowledge and to give me more of a competitive edge against other candidates in the job market. However, at the same time, I came across a volunteer research assistant opportunity as part of the Brain and Mind team at the Murdoch Children's Research Institute, which is also where I work now, to be involved with the screening and recruitment of kids that presented to the emergency department at the Royal Children's Hospital with concussion from playing footy, for example. And this opportunity allowed me to experience what a career in clinical research would be like. And that was something I had not thought of much till then, as I initially thought I would, end up being a scientist doing lab work in the lab. And to this day, I am actually still a volunteer with that group as well. Next slide, please. So yeah, as I mentioned earlier, I had been looking for a postgrad course and I chose a master's in biomedical and health science offered by Monash University. And it had a good mix of coursework in specializations like cancer and infectious diseases. And this was then followed by a 9-month research project in the lab. And I actually completed mine under the supervision of 3 wonderful supervisors in the Department of Pharmacology. And I then ended the course with an industry internship at Janssen, the pharmaceutical company of Johnson & Johnson. And there I supported the Diversity and Inclusion Council to deliver their 2020 strategy. And throughout this course, whilst I had a really great lab experience, I knew long-term I was more interested in a career in clinical research or industry than in the lab. So when I completed my master's, it was actually the beginning of the COVID-19 pandemic and I was looking for jobs and I came across the opportunity to work as a project assistant on a large COVID-19 clinical trial called the BRACE trial at MCRI. So the BRACE trial is looking at giving the BCG vaccine, which is already given to millions around the globe to prevent tuberculosis disease. So to see if it helps protect healthcare workers from COVID-19. Next slide, please. So my role as a project assistant involves project management and coordination duties. So this includes scheduling many Zoom meetings with our collaborators across 5 countries and different time zones, I should mention, taking meeting minutes, answering lots of emails, supporting information management systems to file essential clinical research documents. I also undertake a range of administrative functions and support the trial's communication strategy. So I've been working in this role now for just over a year now. It's been an absolutely rewarding experience being able to be part of and support an Australian-led COVID-19 clinical trial. Thank you.
Brilliant. I guess, yeah, it's good. It's very, very, very current.
Yes.
So it's time now. We're going to move on to our panel discussion. And just a reminder, you can still submit questions through the Q&A function and we will get to them in a little while. So my first question to our panelists, and I might start with Thilanka because you were our last speaker. What advice would you give to your high school self?
Yeah, so the advice I would give to my high school self would be to not put too much pressure to think you have to know what you're going to, definitely do after high school. You'll find that when you go to university, you'll have the opportunity to do a breadth of subjects. So you develop new interests along the way. There'll also be opportunities. For example, when I did the volunteer research opportunity, that was when I discovered an interest in clinical research. And there'll be also jobs in the future that currently don't exist right now. So you never know what will be there in the future.
Nick, did you have some advice for your younger self?
Oh, I can't agree more with Thilanka, and that's sort of my similar advice as well I would give myself. I agree, we are sort of expected to know exactly what we want to do, and a lot of these talks that you come across as well, it seems we all had it all figured out since very young age. No, we didn't. We just went with whatever interest that, just sat well with us. And for me personally, I had to juggle a few different things. And what stood out to me at the time, it was kind of through a process of elimination. You could ask yourself what you like doing, but also more importantly, ask yourself what you don't like doing. That way, take things out of the equation, take things out of the picture. And again, as Thilanka say, you will develop more interest as you go in your career. You might be really interested in maths right now, but after 4 years of university, you might go, oh no more maths, please. So I think it's so important to listen to your heart, and no one knows you better than you do, and you know your interests and you know what you like doing, what you don't. So I think use that, and that's a really good guide.
Can always change, right? Edith, did you have something? I know that you.
I agree with Deakin and Thilanka. Yeah, it's important to pay attention to yourself and what you like, and try to follow that, what the interest that you develop across time. There are going to be a lot of opportunities, like Thilanka said, and you just have to be open to explore them. But I think what I would add is that also, keep an open mind. So like I said in my presentation, I didn't expect to end up in psychology, but I did. And I'm not the most flexible person. So I'm grateful for the younger self, my younger self, who was able to go along with that. But keep an open mind and try to explore things when they come along. Actively look for opportunities, and like volunteering, for example, you could discover a passion in something. So yeah, definitely try those.
Kind of works with my next question, actually, and you could kick us off. What else might you have done? Was there a kind of a fork in the road where you could have chosen a different career path to what you're on? I know the baking was a big one.
Yeah, I think, actuarial science would have been, so if I had got the opportunity to go into that program that I applied for, then that would have been a different path that I would have taken. Sometimes I just wonder of the other life and what it would have looked like. But yeah.
We're glad you ended up on this one.
I am very glad I did too.
Right. Thilanka, what might you have had? Did you have a fork in the road somewhere?
So I think once I found out that, about clinical research and what it entailed, I was kind of very focused on it. I was really interested in it. But I guess the other alternative would have been to do research in a lab. But at the same time, I knew there was other opportunities like doing data entry, doing more face-to-face, clinical research, and get involved in like sales and marketing in the pharmaceutical industry. And that was an area I did not know about until I went to Janssen and spoke to other people about their careers. So I was really interested to gain insights.
No, it's good. Yeah, all the people you talk to helps you out as well. Gives you more options. Nick, did you ever have a time when you were choosing between one and another?
I did. I think the one of the toughest decisions for me early on was to pursue medicine or stick with engineering. And I really enjoyed, the maths and the physics side of things. And the biology was really interesting to me at the time. And medicine just sort of seemed appropriate. But it came back to the whole, process of elimination. And one of the questions I had to confront myself with was, do you like cutting people open and looking at gauze? And unfortunately, Yeah, on TV show, but in real life, not so much. So that's sort of, yeah, that sort of, that was a difficult sort of decision because, you know, it just ticked so many boxes for me at the time, you know, helping people, and you get to be at the cutting edge of technology, practicing medicine. But the big but was that blood and gore, and unfortunately, I just had to take it off the table. And I'm glad I chose this path as well, because now I get to sort of do both. You get to be involved in the medical device side of things, and you get to see the application of it and the impact that you're making. So you might not be directly involved in the I guess the forefront of that interaction, but I'm still working on something that helps with that, and that's really exciting.
For sure. So what do you enjoy most about what you do?
For me, I think it's the challenges. We're doing a lot of new things that no one has tried and no one has attempted, and we're learning things. For me, and I'm 6 months into my job, and I'm learning so much, and I'm still learning, and there's still so much I don't know. And every day is a new day. Every day is another opportunity to learn new skills, learn new areas, new terms. There's just so many things out there, and it's just ridiculous. And just talking, you know, about what Thilanka and Edith was saying, and you know, reaching out to people, talking about their experiences. I think these days we have so many platforms. LinkedIn, for example, it's so easy to reach out to someone, ask about their experiences, learn about what they do or what they have done, and use that method to collect information and see what works for you and what resonates with you. And I think that's such an important thing to do. Just put yourself out there. And if you're not sure what to do, I think that's the best thing to try.
Try everything.
Exactly, and see what ticks for you.
So Edith, what's the best part about what you do? What do you enjoy most?
It's a excitement about how our research could help improve the lives of children with brain injury and children with other neurological conditions. So just knowing that the little work, because sometimes when you're doing a PhD, for example, it feels like you're doing this little work and you're spending 4 years doing that thing for so long, and sometimes you find yourself asking, to what point? But when you look at the bigger picture, you realize that it's actually contributing to someone's clinical discussion to help improve policies or to help improve decisions around a particular child's condition. And that I find very exciting. Yeah.
It's great. Yeah, kids are a good way to see those results much quicker. And Thilanka, what do you enjoy most about it? You saying you work across 5 time zones is a terrible thing for me.
Yes, we have like early morning meetings, late meetings, but it's really wonderful. Like I actually enjoy working as part of a diverse and multidisciplinary team. I get to work with like lab staff, researchers, clinic teams, research teams. So I get to communicate with people across the board. And every day, as Nick was saying, it's a new day. It's another aspect of science I love. It's constantly changing and evolving. There's new discoveries being made every day. And ultimately, you're part of a shared goal to increase scientific knowledge and improve patient care. And I think that's something we're all very passionate about. And for me, being part of a COVID-19 trial, it's very current. So that's very exciting.
That's great. Okay, so my next question is about IMNIS mentors, and I might go to Edith first on this one. What was the best advice that your IMNIS mentor gave you?
My best advice that my IMNIS mentor gave me, that would be around networking and valuing people. Yeah. So she stressed quite a lot on that, and so when we would maybe discuss challenges that I was facing at any stage of my career path, we would go through the challenges, but it would come back to the importance of like the relationships in that context and valuing them and keeping them well. So I think that was great advice, because in hindsight, I see how the people that I have met, not well, because I've been in Melbourne for about 6 years. I haven't been here that long, but I see how those relationships have contributed to where I am and where I'm going right now. So that was great advice. Yeah.
Okay, Nick, what did your IMNIS mentor give you?
So my mentor, James, worked in medical device industry as well. And he's helped me so much through my transition, definitely with a lot of pointers. But I think the main takeaway for me was not so much a piece of advice, more the interaction with him throughout the whole program. And he's honest and upfront, which is great. And he helped identify, the gaps in, for example, in my CV. And one of the things that stood out to me, and again, I was very useful, was the practicality of say, tasks or experiences that I've done. How do you translate that? How do you make that relevant to the employers that you're approaching? So the interaction, just the 1 year interaction with him, really shapes the way I approach, for example, job hunting, and just how I present myself. And it was through the interactions to and fro that yeah, I really appreciate and learn a lot about the process, and just, I guess, me as a person as well. So
it's that external person looking at your things, sometimes
exactly, it's yeah, exactly, it's a fresh pair of eyes, and you get so much valuable information and feedback from, which is, yeah, really useful. So everyone should get a mentor.
Yeah, any age you can get one.
Exactly.
Thilanka, what was your best advice from your IMNIS mentor?
Yeah, so my mentor worked for a pharmaceutical company, and she had years of experience working in various clinical research roles. So I had gained lots of valuable knowledge from her about what other roles there are in clinical research. And she helped me identify like the transferable skills from my academic and research experiences, and then applying that to like CVs and cover letters to help enhance my job prospects. So it was a really, great experience to get her insights, as an external person.
I had one quick question for Nick about his work. What's the difference between a needle and a microneedle?
Sure. So imagine, what we currently use, the hypodermic needle that you can see with your naked eye, they're sharp and they're not very pleasant to look at, and they go into your skin. So microneedle, essentially, it's short for, I guess, micro scale needle. And it's a big field of research, and there are many companies and research labs working on similar idea. But essentially, it's a miniaturized version of the needles, and because they are short, they don't engage the skin as deeply, so they don't necessarily trigger the nerve endings that cause pain when you put in your hypodermic needle. And through that engagement, you can deliver drugs and vaccines and all sorts of substances, useful substances, into the body without causing too much pain and harm, as the current method does.
That's great. And pain, I love it.
Pain-free, supposedly pain-free.
So I have a final question for our panel, which I love to ask anybody who comes on Careers in Science. But what do you do when you're not doing science? And I'm happy for anyone to volunteer going first on this one. No one's keen.
I'm happy to go first. So I love baking, and in my spare time. But I think part of the reason is because I love eating as well. So so it's a good combination. And I do marathon running as well on the side when I have time, and I have the motivation.
Yes, when you need motivation for it.
Definitely.
Edith, what do you do when you do science?
Yeah, I love trees, so I just like to go on a walk and just take pictures of cool trees. Yeah. So yeah, and sometimes I end up creating stories behind the trees as well, and just maybe simple motivational quotes or just a story. Yeah.
Cool. What are we doing? Thilanka, when we're not doing science?
I'm the same as Nick. I love baking as well. I have a sweet tooth. I love food. So, going out for food and stuff, hanging out with friends, just doing some fun activities, like bowling, done a bit of rock climbing, indoors, of course, not there yet. But yeah, just activities and stuff like that.
We need to exchange recipes.
Yeah.
Oh, did you? That's cool.
I'm happy to taste recipes at any point. Always good to be a taste tester. Well, I want to thank you all for joining us today, and especially our 4 panelists for talking about their work and about themselves a little bit, which we've really enjoyed hearing. And this is our first series between IMNIS and STELR, the REDI Careers Beyond the Lab, and we hope to be able to do many more. And I'd like to acknowledge the partners and supporters of IMNIS, STELR program, and also the Academy of Technology and Engineering as well. A huge thank you to our IMNIS catalysts today, Dr. Nick Hong Seng Lee, Dr. Edith Botchway, and Dr. Thilanka Morawakage. Oh, we really value your insights, and we hope that everybody online has learned a little bit today from our speakers and careers beyond the lab. Thank you.